Your visual system develops around like age 6. If you have head injuries prior to that age, that can create problems for somebody for their future. Cranium is very sensitive, and we have a head injury and that blunt force to the head. It can really change how that brain understands those bones, the tissues, the structure. You are almost 10 times more likely to have a retinal detachment. If you have LASIK, you can go blind. You can sit and do shoulders down and back and all these things that we're taught at a young age, and it's just going to make your posture worse. There is a lot of research to show that what happens between age 0 to like 15, it's instrumental with how the rest of your life plays out.
That's where I think the traditional medical system is so broken.
But is this really how we're meant to be living?
Welcome to another episode of Biohack-it, and today I'm going to introduce you to somebody very special. I had a session with this incredible woman this morning, and my mind is still trying to understand what happened in that session. But let me not wait any further. Aleena, thank you for doing this with me.
Thank you for having me.
So Aleena Canner is a restoration therapist and certified athletic trainer with a passion for helping others with chronic pain. With background in athletic training, she works with the neurology and psychology of the body to help restore sensation, realign position, and repattern the nervous system. The repattern of the nervous system happened to me today. So I'm going to explain to everybody watching what I experienced today. We had a session this morning because I wanted to kind of experience your work and what you do and kind of bring it on, because it's very unusual, right? There's not like an osteopath or a chiropractor. So I booked in a session with you. And so I get there, like, guys, I'm awake, I'm happy, I'm ready to go. Aleena starts working on me, and 30 minutes into the session, and mind you, it's not like aggressive anything. I felt as if I got hit by a bus. I just started falling asleep. I'm like, what is going on here? I felt like I was drugged, like it was roofied in a good way. But because my nervous system started relaxing so much. And by the end of the session, I was like, where am I? I think you might just have to leave me here to nap.
Yeah, you melted. You literally melted.
It was crazy. And I'm going to show you guys videos of this. And then Jackie came. We were going to grab lunch before this podcast session. And I was having moments of emotional release in the car. Little things like childhood memories would come up. And I was going through. And then finally we had lunch and I woke up all of a sudden. My body came back to itself. And I was like, wow, that was a real journey. So tell us, what is this? Talk to us about this.
Yeah. Well, so with postural restoration, I don't always know where it's going to go for somebody. I'm always treating what I see and what comes in. And I just did that for you. And your experience is very unique to you. And I couldn't tell you that was going to happen to you, with what we did. But we did, breathing exercises.
Yes.
I played with your sense.
Look at how open my sinus is right now. I was so congested this morning.
It's amazing to me too, because I know what my work can do for people, but I don't always know what the outcome is going to be in that first session. But that's really where I learned so much about the person. So that tells me so much about you and how much your body really needed that. So
how did you get into this? How did you learn about this? And you're one of the very few people, I researched it back to front, front to back. You're one of the very few people doing this, right? Yeah. So how did you get into this work?
Yeah, there's only really 200 providers that are certified in the country. So it's really small. It's a very niche thing. Basically, I went to University of Arkansas to study athletic training, and I always explain what that is. So I'm a certified athletic trainer. It's a master's degree in understanding and working with professional sports teams and being able to help them with their injuries, rehab, pre and post surgery, as well as emergency management of those teams. You can work at the collegiate level, professional level. I ultimately wanted to go work for USA Gymnastics, and then my mindset kind of shifted as I graduated, and I really wanted to just help people more with being able to give them that time. Because when you're working in that team setting, you have to patch them up and get them going. You can't actually help them with their root cause of why they're having problems.
Yeah, it's just get them to optimize themselves for what needs to be done right in front of them.
Right, and these sports teams, whether it's college or professional, they just want to capitalize on these individuals, and I wholeheartedly could not be in that system.
You want to support their larger healing.
Yes, I wanted to, and I get so many retired athletes now, and that's always really bittersweet for me. But so as I continued after I graduated, I started to dabble into a lot of different things, and I saw this postural restoration. And I took a course with Ron Hruska, who's the founder of the Institute. And I was beyond blown away and also very confused. And I knew that it would be something I would get to, but at that point I wasn't really ready to learn the information because it is very difficult to learn. So I came back a year later and took another course, and I just kept taking courses and courses. And I'm pretty like, at this point I've taken so many courses, and I also moved across the country to try and like learn it and leave New York and experience it. And so that is how I was able to develop at a faster rate than maybe some of my peers.
And you said, we just learned today, this morning, you showed me 2 techniques, but you said there's 720 or 750?
Like 700 plus techniques.
That's crazy.
And you did one real breathing technique. I gave you 2. And you really melted.
I'm still trying to get my head around that session because, I do a lot of like plant medicine, I do acupuncture, I do so much stuff, but that was so unique. And I'm telling you, I was on that table and I was like, she's going to have to leave the room. I need to sleep. Like my body needs to curl up into fetal position, just take a nap.
Yeah, I've had people have that response. It's not everybody, but some people really do have a response like that. Like I shared with you that I've had, some of my responses with postural restoration. Everyone is so unique and different, so I don't know how people are going to respond.
I want to also talk about a little bit deeper into your childhood, right?
Sure.
So H12 braces, H10 braces, H12 first head injury. And I was talking to you about the concussion that I had as a child. So let's get into what childhood like injuries can lead into when it comes to development.
So your visual system develops around like age 6. So if you have head injuries prior to that age, that can be something to look into for the future. It can stunt, not development, but it can create problems for somebody for their future. So I didn't have a head injury at that age, but I do see that a lot in the clinic. I do see people get head injuries and then maybe they have more issues following that head injury. So me and you connected on the fact that and I talked about this with you, I had a head injury around age 12, and within 3 years, I got my first pair of glasses. Nobody in my family has glasses for distance. I was in glasses for 15 years. As you saw, I still wear glasses, but what I'm wearing now is very different than what I wore 10, 15 years ago, even 5 years ago. And so we can make major changes if we know what's going on there.
Yeah.
So the cranium is very sensitive, and we have a head injury and that blunt force to the head. It can really change how that brain understands those bones, the tissues, the structure.
Yeah, because you were explaining to me about the whole system with the eyes and balance. And so I want to talk a little bit more about that too.
Yeah. So, right. So your visual system really tells you where you're at in space. And if the eyes don't function well together, or if you have any sort of binocular vision dysfunction, it can create problems. And we do see this, we see this in children, and there would be obvious ones. And those children that have these eye turns later in life, they might have chronic pain. I get a lot of them in the clinic.
Wow.
So there are things that you can do to make them feel better despite having a structural issue. So it's definitely something to look at. And I think a lot of people, vision therapists, optometrists that have a behavioral optometry standpoint, neurooptometry, they are definitely looking at this. But my perspective is different because I'm looking at the body. People are coming to me with a body complaint, not a vision complaint. And then I find something that might need a visual attention towards it.
And based on this, like the work you're doing, what are you seeing people come in for the most in their 20s, their 30s, and 40s?
Yeah. So postural restoration is interesting because people can come to me with really anything at this point. So with PRI, we're looking at the senses of the body. So how their eyes work together. We're looking at how their teeth touch, and we're looking at how their feet, interact with the ground, as well as the respiratory system. So somebody might even come to me. Of course, I see a lot of chronic pain. So in the 20s, I'd say most people at this point are coming to me with issues with TMJ. I see a lot of TMJ.
Right.
We also see like anything from pelvic floor pain, pain, dysfunction, leaking. We're seeing very interesting chronic neck tension with the way that we are on our devices. So these are very common things. Now, I also have seen, other more uncommon things like specific, very detailed foot pain in this one area when I only do this. So we get a lot of things. Now, I'd say 20s and 30s are quite similar. I think 40s, 50-year-old, as people get older, we see way more individuals that their teeth were pulled and they might be having neck tension because of that. I'm not seeing that in the younger people as much, but definitely there's a commonality with that generation around, I'd say 35, 38 years old to like 50s. That generation had a lot of premolars pulled, and that creates problems.
And I told you, I shared that I've had, I think, 6 to 8 extractions, and then you could see it in my mouth. So let's go into that a little bit.
Yeah. So it used to be back in the day, and honestly, it's
We're
still
giving away our age now.
back in the day. No, they just like, I mean, they still do it. I just had an 18-year-old with this. Yeah, this is
even
still
now
happening.
with all the education that they have?
Yes, because they're still teaching it in school. So, and we should talk about what it is. But basically, they used to take out the premolars when they saw that there wasn't enough room in the mouth. And so they'll say, okay, maybe somebody sucked their thumb. And if they suck their thumb, right, me too, then that palate is narrow. So instead of widening it, which is what we do now, let's just pull the teeth and make everything smaller.
Yeah.
And that was the thought process. And honestly, it still is the thought process. I had a 12-year-old like earlier this year, and they pulled her canines. Like, this is crazy things. This is not as common now. The new thought process on airway is let's do all this expansion. People are definitely looking at it differently. We're looking in a different way at the dental component.
And you also were explaining how like Invisalign is a no-go.
Yeah. So like all of these things are all bits and pieces of my profession, right? So Invisalign, it's not that it's a problem necessarily. It's just that, well, I guess I should explain a little bit about the patterns.
Yes,
and that'll make a little more sense to everybody listening. Well, we have a diaphragm on the right side that is bigger than the diaphragm on the left side. We have 3 lobes of lung on our right side and 2 on the left. And we have a liver that's 3 pounds on average that is only on our right side. We have a heart on the left side that keeps the left chest wall open. So when we have these asymmetries in our organ placement, which is all normal, we need to have this to function through life, we see a little bit of what we call a lateralization to the right. And then we have a world that is made for righties. So everything we do, like we talked about earlier, you open up a refrigerator, you're using your right hand. A lot of people, 90% of people are righties. There's a reason for that. So because of these asymmetries, our bodies morph into different patterns. And so we have certain things doing harder work on one side of our body and certain muscles doing harder work on the other side of our body. And in order to be able to walk properly in life, we need to be able to have this homeostasis where we can go from right to left. Everything in life is like this balance. That's what I've learned as I've gotten older. You always have to have one yin and yang, right? So with that, what I see a lot in the clinic is people getting stuck in one pattern, whether that's being over on their right leg with left pelvis coming forward with, we'll see a lot of right shoulders that are lower than left. We see certain facial asymmetries that coincide with this body patterning. And we're looking at it from a systemic point of view. So now you ask about Invisalign. So Invisalign is not necessarily a problem if one can go right versus left. Like when you're leaving today, you can go onto your right leg and you can go onto your left leg. The goal would be that that person can do that prior to them doing Invisalign, because then the teeth will move and they will be able to get whatever the dentist is looking for. So Invisalign is a problem when someone's nervous system isn't ready for it and when they're really stuck over on one side of their body with the inability to what we call oscillate, move right back and forth. And the same goes for teeth shifting after having braces. A lot of people are concerned, I had braces for 5 years. Mm-hmm. My teeth are going to shift. I need my permanent retainers. And this is just like a huge deal. People do not love this topic. But in my world, why are teeth shifting in the first place? They're shifting to find center. So if you're far over on your right leg, teeth are just going to try and pull you back because teeth are very sensory organ. We don't even think about how teeth are so neurological in nature. So when it comes down to it, if your body is in a good position where you can go right and left, teeth won't move post braces. So all of these things, dental and vision, are so important for our body. And that's where I come into play.
You know what was so fascinating today? So for everybody listening and kind of tuning in, so my right side was more like kind of loose and ready to go, but my left side was super stuck. So Aleena comes up to me and she goes, "Take this." It was, what was it?
I gave you a little popsicle stick, like a coffee
still,
stirrer.
Right? And Aleena was like, "Put this in your mouth." And I bit down on it. And the minute I bit down on it, my whole left side totally opened up. And it wasn't like we put pressure or adjusted it just opened up because you said of the mouth-brain connection.
Yeah. So, and it's funny because I'll post this stuff and people will always be like, oh no, she's doing it, but you felt it.
No, my whole
You
left
know.
side totally opened up. And then when we retested me, because I recorded all of this, so I have it. It was crazy because my body held onto a little memory of that. And because I was biting the little popsicle stick for a bit, it was crazy. We wouldn't have a podcast talking about optimizing women's health without talking about BodyBio. I use BodyBio every single day, and their hero product is a necessity for everyone in my house. PCs of pure liposomal phospholipid complex that helps protect the 70 trillion cells in our body from aging, environmental stressors, and toxin exposure. This little guy is great for everyone, you, your husband, your kids, and even your pets. Our health truly starts with ourselves, and PC gives them the support and maintenance they need. To learn more about BodyBio, head over to their website, www.bodybio.com, and use the code Biohack-it for 20% off your first order. And if you've already purchased BodyBio and want to rebuy, use Iman at checkout for 15% off all your orders.
I am playing with your sense and your brain's perception of that sense. And so when I change how your brain understands how your teeth are touching, which is called your dental occlusion, ultimately your rib cage was now able to rotate to the left. That's what really happened.
That's what happened.
Scientifically. Yeah. So before you had a rib cage that was more stuck, and I put that in your mouth and your brain melted. And that's because I could see it in the testing, but it's because I gave your brain a different
cue
sense. Yes. And then it was interesting that you held on to it because people that are very tight and very stressed won't hold on to it. They'll immediately, they bite their teeth together, it goes right back. And if I were to test you now, I think it will be full range of motion because the way that you left in today's session, I know you're going to hold on to it for a while.
Yeah, it was amazing. Maybe it's because we spoke about this too, that I did acupuncture on Monday and I kind of tuned more into my body. And then we also touched upon LASIK because I said to you, oh, should I get LASIK done? Because, contacts, there's so much research to show they can be super toxic. And you said something very interesting to me. So I'm not doing LASIK now.
Yeah, I know. I sold you. And I hate telling people this stuff, but
But it's good we know.
Yeah, well, it's important to know. And the LASIK industry is definitely not going to tell you that. So about LASIK, it's the same thing with Invisalign. So if you have a body that's more stuck over on that right leg, and then you put a prescription, even if you don't have LASIK, if you put an eye prescription on that's incorrect, you're kind of holding your body hostage over on that side. And the other issue with LASIK from a health perspective is that I've read about 3 studies that you are almost 10 times more likely to have a retinal detachment if you have LASIK. So people that do have LASIK, whenever they come in to see me, I will always tell them you have to have yearly eye checks because a retinal detachment, you can go blind. So it's dangerous, right?
And you said that happened to somebody you know.
Well, I have had patients where they have had major complications post-LASIK. They're coming to me because maybe they had LASIK 10, 12 years ago and they've been in neck pain for the last 7 years. And I timeline it the same way I timelined your head injury. I look and I ask these specific questions. Everything is always in the history.
Mm-hmm.
As long as I ask a detailed history, I'm going to find what's going on. And I timeline it with these LASIK patients and I'll see they had LASIK. And then 3 years after LASIK, they've had this chronic neck pain that can't go away. They've done everything. They've tried everything. They come to me, they do 5, 6, 7 sessions, and they're still not getting better. Then I go with them to my behavioral optometrist. And we sometimes have to give this person glasses, which is so unfortunate because they got LASIK so they wouldn't have to wear glasses or contacts. And now I'm telling them, I'm sorry you got LASIK. Now you have to wear this.
And the neck pain goes away after they start wearing glasses?
Yes, it depends on the person, of course. Like some cases with vision cases can be quite complicated. However, I've seen success with, we play with different prisms. We play with different types of lenses that can move your body according to what they do with the space. So.
Expanding actually on that, what a role, big role vision actually plays. Can we talk about that for a second?
Yeah, it's I think it's 90% of what we use to sense our where we are. So it's different if, of course, you're born blind, you're going to be using your other senses. But if you were born as a seeing human, you're going to rely on your visual system. So I like to think of it like this. If you're standing on a cliff, your body posture is going to change because of your surroundings.
Mm-hmm.
And your body posture is going to be very different, like us here, sitting here. We're very comfortable. But if we took this chair and put it on the edge of a cliff, we would not have this body posture. That's how much vision plays a role in what I do. So it's something people don't think about.
Right. I didn't think about it quite like I did, but not into the depth of what happened today and kind of like looked at it from a different kind of viewpoint.
I could have done that to you today by patching one of your eyes. I probably could have made some similar changes, but I knew because of your history with your taking out the premolars, I knew that would be an immediate impact. So it all depends on that person's history, what I'm going to go after. At the same time, that's just maybe the popsicle thing is a trick to show you how much these systems impact your nervous system.
Right.
They are your nervous system, which is why you had such
crazy,
emotional, so much impact.
I can't tell you. I went from being super alert and awake, and I keep on saying this, to being like, I just need to pass out. Like, I don't know if I'm going to make it into the Uber even.
I mean, yeah, and I could not have predicted that for you, but I do think your body really needed that.
Reset, yes.
Yeah, it's a reset. It took you out of that sympathetic overdrive that you might have been in just being in New York for the last few days. That just being in the city does that to people. New Yorkers are the hardest people to treat.
Yeah, because it's the energy, it's the chaos in the city, it's the overstimulation, it's the lights, like
it's a lot.
It's all go, 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 and so that really plays havoc on our nervous system.
Yeah, and New Yorkers who've lived here for so long don't see it because
that's their norm, that's their baseline.
Right, but I've treated people in Texas, Arizona, California. I've treated people all over. New York is by far the hardest place to work, I think.
I think it's the frequency of this place. Like,
I agree.
In my 20s and 30s, I could do it. Now I come into my 40s and I'm like, I just do a few days and I was like, I'm ready to go back because it overstimulates me. And for somebody like me who's already running on like pretty high energy, I don't need that. Like, I need the opposite.
Yeah, I can completely relate. I just told you I was away for the last 5 weeks on the West Coast, and I come back here and I can handle it better than when I left. But is this really how we're meant to be living? Like,
no,
I know it's not.
I discussed this yesterday in an episode I shot that our DNA has not evolved as fast as we as a species are evolving, like the technology and the 5G towers and the shit that's going into our food and stuff, but our DNA hasn't evolved that fast. So that's where a lot of disease and disconnect is coming into our bodies because there's that huge shift between your DNA about what it still can do in its surroundings to how we're living so aggressively these days.
Yeah, we're just not one with nature that we were,
which we're meant to be in. Yeah, exactly. Everywhere you go, there's like a huge skyrise, and it's like, no,
New York is really hard. And I'm born on Long Island. Like I'm a New Yorker. It is so hard for me. I struggle with it on a daily basis.
We're gonna have to move you somewhere else.
Well, yeah, I'm in the process. I've lived in a few places, and it's like everybody jokes about New York or nowhere.
Yeah,
and it's funny because I understand, but. Yeah, I love the West Coast.
My husband was a New Yorker for 16 years.
That's a long time.
When he first moved to Miami in 2020, he like really struggled in the beginning, but his nervous system was so dysregulated. And now you meet him, he's a totally different guy.
Yeah, because
he's so much more zen.
Yeah, of course. I don't think it's very hard to live in Manhattan and have that same peace that you would in a more nature-driven place.
He wakes up, we have our dogs, it's very quiet where we live. And so he's a different guy to the guy who used to wake up with like, okay, I got to do this. And now he's like, oh, I'm chilled. Like, it's fine. Like, but it took about 2 years from when he moved down to fall more into that.
Sure.
And get into meditation and breath work and cold plunge. It's like that all started, he started doing everything to calm his nervous system down.
Right. So then think of it like this. This is, I think, a great example. I have these people that are in that state, but then they've had premolars taken out of their cranium. So that takes away a piece of their grounding. They're wearing shoes that are not meant for how we should be walking in a concrete jungle of New York City. And let's say they're wearing an overprescribed contact. Let's say they've had 2 head injuries. That person cannot tolerate New York City.
No,
they can't. And maybe they have Lyme disease on top of it. Like,
right. Yeah.
Then there's this whole other model of holistic health that is very important to be implemented alongside with what I do. So what I do is more, let's deal with this. I don't really even like to say orthopedic because it's not really an orthopedic. It's very neurological.
Yeah.
You experienced it.
My body's still experiencing it.
But my baseline of training is like an orthopedic training, right? So I look, okay, you have pain here, right? I'm looking at pain.
You also talked about shoes and how we're meant to be walking. So I want to share that.
Yeah. So, and people like hate this topic. They go crazy over this topic because everybody likes their shoes a certain way, right? But we are today, in today's society, we walk on wood floors, we walk on concrete, we walk on flat, even surfaces. But in reality, our bodies, like you were saying before, we have not developed enough to deal with our modern society. Our bodies are meant to be walking on uneven surfaces like the desert, like a beach, any sort of jungle floor where you have sand, you have leaves, you have gravel, you have all these different, rocks and variation of this uneven surface. That's what we're meant to be on. So the barefoot shoe companies out there, which no hate, but this is just my
observation,
opinion, and what I've seen in the clinic. The barefoot shoe companies take that marketing and they say we're meant to walk on uneven surfaces, or we're meant to walk on these uneven surfaces that are, ground, the rocks, etc. So let's put you in a shoe that makes you feel the ground more.
But you're still walking on a flat surface.
Exactly, because now I bought them when I was living in London, or not living when I was in London, and you're in a city. And so either way, I'm wearing now a barefoot shoe on a flat surface. So what is the point there? That is revving up somebody's nervous system like tenfold. And so I have a problem with the barefoot shoe companies because their marketing is smart.
Yeah.
But they're missing the biggest point.
Yeah, which is the surface that you're walking on.
You actually need a shoe that has an arch support and a heel counter to allow your brain to what we call be grounded, which sounds weird that I'm putting a cushiony shoe on somebody to give them grounding, because you still need grounding, like the frequency exchange from the earth. But you need grounding, in my opinion, from something touching your arches of your foot, something holding the back of your heel that allows for that, your calcaneus to be guided, which is your heel bone. So those things can make such a big difference for people. I've seen the craziest things with just getting somebody in a good shoe for the majority of their day.
That's crazy. And I saw the shoes that you were wearing and stuff. And then that made sense to me because I was like, I have really high arches, but my feet get really sore. When I wear flats a lot of the times. I don't even wear heels anymore because after 2020, unless I'm going out at night, forget it.
Right. And that's the thing. So you have high arches. So your brain has lifted that arch up because you are just floating away a little bit. So what I would do for that is put you in a shoe with a higher arch to get something that touches that arch. Because ultimately, those arches are very important for many reasons. They allow you to get into that parasympathetic calm system. And they also allow you to transition from one leg to the other leg because you press through that arch. You do something called pronation. And when you pronate that foot, you're able to push off and move forward in life. But you have to be able to pronate each foot to do that. So without an arch there, your brain is like, okay, I'm just going to stay up here.
Right.
And that's a problem. So if you get in, and you don't have to be in it that often. For somebody like you, your body took what I gave you this morning so easily.
And ran with it.
Yeah. So I would even just say get a good shoe, which I'll send you all that. And just like if you go on a walk outside and be in a good shoe, and that would be enough to get you into this parasympathetic on a daily basis. I mean, Dr. Jess, I got her in good shoes. And she was always in a pretty good shoe, but I actually made her something for her shoes and she loves that.
Yeah.
I saw her recently. I was like, you're still wearing those? She's like, I love them.
Yeah, it makes her feel so good. Why take them off?
A specific orthotic that we make. There's like one guy in this country that makes them the way that I do.
Okay.
Because there's tons of orthotics out there, but there's a specific
one that you work with. So if you want to know the scoop, you got to follow Aleena and she's going to let you know.
Yeah.
I want to talk about what is asymmetry in humans and what are the different types and why is it important? You said something today that I didn't have as much asymmetry given the amount of extractions I've had.
Yeah. Yeah, because we will see asymmetry with when people extract teeth. Asymmetry in humans, there's a bit of it that is a normal amount. So because we have a diaphragm on the right side that's bigger than the diaphragm on the left, we have the 3 lobes of lung on the right, we have a liver on the right side. There's some asymmetry that's normal, but anything that is excessive, so body asymmetry that I'll see, anything that is more than normal, that is because that person doesn't know how to manage it. So like I mentioned earlier, a right shoulder that's lower than the left, we see that often, but I'm not going to say that we don't see it the other way. So everything that I see, I also see in the other direction. We'll see a right eye that is lower than the left, but again, we might see it in the other way. We'll see a jaw that will mainly deviate to the left. Sometimes we see it the other direction. It's just basically like, I'll explain it like this. I say asymmetry, like everybody has skin. And then some people have tattoos. So those are layers of compensation. So you can have your skin layer is what I normally will see in the clinic. And then people that have tattoos are people that have had head injuries or different things in their life that have made their body compensate into a different position. We'll see arches of the feet. The right one is higher than the left. You're more symmetrical with certain things. Your pelvis was more in a symmetrical position. But then what I did for you is I actually got you out of it completely. And so that's the goal when somebody comes to see me. And certain people have a harder time than others. Yeah.
And would you, like talking about posture, right? How was my posture, actually? I should have asked.
It's pretty good.
It was good, okay?
Remember I took those pictures
Okay,
of you?
yeah, you did. So, but I felt a huge shift. Why I'm asking is because I felt a really big shift from before the session when I walked to after.
Yeah.
So I'm wondering about how bad like my posture was prior, but I did feel a shift in my body.
Right. So it's not that your posture was bad. It's just that you were lateralized to your right side. And so what I did was I gave you access to this left side. Now, I gave you one or two things to work on. Technically, you want to have a couple things to work on, and eventually that holds, and that's your new resting posture. If you look at the pictures of me from 5 years ago, I was a gymnast. So I had what society deems as very good posture, but what I look at as very poor breathing pattern and very inability to utilize a diaphragm. And so with time, I don't look as arched. I will always have a certain what we call lordosis in the back because of the training I did in my life. But now I can breathe proper. So that's kind of what I gave you. Airflow dictates posture. You can sit and, do shoulders down and back and all these things that we're taught at a young age for years. And it's just going to make your posture worse because you can't muscle your way into a better posture, but you can breathe your way there.
Obviously, you all know I'm a biohacking fanatic and I absolutely love peptides. So you can only understand how excited I was when I discovered a skincare brand that works, that uses peptides. That is OneSkin. OneSkin uses the amazing OS1 peptide. OS1 works by actually switching off the senescent cells that drive the aging of your skin. Scientifically proven to give you biologically younger skin with long-lasting improvements in firmness, elasticity, reduction of fine lines and wrinkles, and a more youthful complexion. You can learn more about the OS1 peptide at oneskin.co and use my code Biohack-it for 15% off your purchase. It's, one of the things I'm learning more and more doing these episodes and meeting people like yourself. The two big takeaways I've had till date is your breath plays such a big role and it's not spoken about enough. And you don't have to do massive breath work. That's not what I'm saying, but your breath is almost everything in so many different ways.
Yeah.
It's crazy.
It's vital. And
how you breathe, not just like, I'm breathing. It's like how you're breathing.
And it's funny. I remember when I was first getting into this, I had like some chiropractor be like, oh, well, everybody breathes, so you don't have to worry about it. And now it's like, wow, my entire practice is about breathing.
Yeah. And doing that, I was so congested and I did that breath work exercise the way you made me do it, those exercises, and my whole sinus opened up. And then the second thing I'm realizing is that in the functional world, people who are really looking at history from a position of childhood trauma, emotional or physical, what actually happened to you from the age of 0 to 12 or 0 to 7 is really dictating what's coming up in you as an adult. So people who are just trying to take your labs and check your symptoms now are missing a very big piece of treating clients and patients in a full spectrum way.
Yeah. I mean, this is why I take such an in-depth history. I mean, you saw my form.
Yeah.
And that's just for me to guide the way the history portion of the session is going to go. I ask everything because if I don't know, then it makes my job harder. And I do think you're right. They have the ACE childhood score of trauma. It's like there is a lot of research to show that what happens between age 0 to as you're older, 15, whatever, 12, it's instrumental with how the rest of your life plays out. And the same goes for the injuries that I'm looking at, these more orthopedic injuries. You have a break of your right leg when you're 8, 9 years old. That could dictate how you use that right leg in the future. That tells me, if you were casted, I had a girl that was in a wheelchair for like 6 months. She didn't use her legs. Like that is going to tell me. That's going to tell me what she's doing now as an adult, and maybe why she's walking the way she's walking, and what I can do for that. So I think those years are instrumental.
It's really, really crazy not crazy, but it makes so much sense. But that's where I think the traditional medical system is so broken, because they're just, or even sometimes functional. They're not like, functional people are not looking at your full back history, asking you about your childhood, asking about your programming, traumas you've experienced. And they're missing a very big part in what makes you you today and how they're meant to treat that fully.
I agree. And it's the same with this more orthopedic mindset too. Like the things I learned in school, I probably use 10% of what I'm learning and what I learned in school. And that was the education I paid. The amount I've learned after school from people, from mentors, and from certain CEU courses is the reason that I'm this provider, like what I'm doing. But I do think that there is a big break in the difference between the conventional traditional system and what they're learning, and then how people are practicing with more of an alternative style. And I do agree with you about functional medicine sometimes missing the boat on things. And it's the same with a more regular, you go to a chiropractor because you think that's going to be better. But in reality, the chiropractic schools are all regulated. It's the same. They're going to learn the same things everywhere. And if that is 20, 30 years behind, then what are we really doing for people?
Right. I want to talk about the risks also, because we're talking about posture right now. What are some of the risks that come up if you have poor posture and you don't even know about it? And how can somebody check if they have poor posture? And, they're listening to this and they're like, hey, how do I check this?
Yeah, so I don't think visible posture is the best way to look at things.
Okay.
Like, yes,
Wow.
you can look at somebody and be like, oh, that's not great. Like, they have a rib flare, but everybody just immediately goes to look like, oh, my shoulders are rounding. Oh, but there's a reason why your body's doing all that. So I'll say to start, the things that we can look at is like if you're laying down and you see that your ribs are really lifted up high towards the ceiling, we will typically see either both ones lift or the left one lift. That tells me an inability to properly get your air out. If you have pelvis that just feels like it's always very forward, it's also hard to tell this visibly. That could be an issue with how you're regulating. So those people, those like banana back people, that's, to me, that's an inability to breathe. That's not good posture. Good posture is being able to expand your chest, being able to expand into your upper back, and not use your neck to pull air up. Yes, we talked about that. And then good posture is being able to sense things, your surroundings. So when I say, if you sit down, can you feel your what we call sit bones? It's really important that people can feel that. Can you feel both your feet evenly on the floor? That's important. Now, the risks associated with poor posture are inability to properly breathe. And people don't even think that's a problem or don't even realize that's a problem. But things like hernias, that's the inability to breathe. Things like pelvic floor dysfunction, where people are leaking, that's related to how one is managing their internal pressure. So these are things I see all the time. Yeah, hernias tell me that the gut tissue came forward. So we should be able to breathe and expand everywhere. But that person, even at a young age, I've seen hernias at like 5 years old. It tells me, what I look back, if I've had patients with like 5-year-old, right? They have a hernia, they surgically fix it, but what happened during that person's birth? That's what I want to know.
Okay.
And so I look at all of that stuff. But yeah.
And poor posture can also lead to intestinal problems?
To what?
Intestinal problems, like your intestines, yeah.
Yeah, I mean, that's like the same thing with the hernia. That's like intestines are coming out. So yeah, and I've also even had people that are constipated. They come in to see me and they leave and they're like, oh my gosh, this is crazy. I need to do these. Because if you think of a rib cage that's lifted up and a pelvis that's coming forward, all the guts are now coming forward. If we realign that with the breath, now everything can function properly. It's wild.
It's wild how interconnected things are. I also read somewhere, and you can expand on this, that studies have shown that posture can also aid in memory forming when it comes to toddlers learning new things.
Yeah, I mean, with little kids, the biggest issue right now, and what I'm seeing, is that children are so much in front of these devices and they are not able to learn to properly communicate. They are not doing play. So regular play, I just read a book, it's called Play. And it talks about how kids playing without instruction makes strong adults. And things like memory problems, if you are staring at these screens, we're going to have these issues.
You're not training your brain, actually.
Right.
Yeah.
So I will see people that play video games and I will know if they played video games just by how they look, posture wise. They will have certain positions of their back that I can tell. And if you are playing video games or like, and that's what you're mainly doing, or if you are on the screens a lot, you're going to have this more pulled forward position in your body. So everything's coming forward. You're always here. Your head and neck are coming forward. That's going to change how your brain understands things like memory, understands things like your entire body, where you are in space. So it's not even just with little kids, but I think play is a big thing at a young age.
And we've talked briefly also about, you were educating me on mouth tape, because I said, I went to a dentist recently and he said, hey, you definitely mouth breathe it. And I'm like, really? And we talked about taping and it's becoming such a big trend and you have all these influencers posting about it, but there's some dangers around there.
Yeah. Yes. So actually, even just what we were just talking about with these little kids. So kids are having a lot of these problems where they're mouth breathing. And it's because of our society and the way that we're doing things. And there's a lot of reasons. But what we talked about specifically with nasal breathing versus mouth breathing, nasal breathing is your primary mechanism for where you're supposed to breathe. You're supposed to breathe through your nose. That is the main way that we should breathe. And what we're seeing is all these kids, these adults are just breathing through the mouth. And the mouth is a secondary breathing mechanism. The nose promotes nitric oxide formation. There's so many positive things by breathing through your nose. And when we see people that breathe through their mouth, I read that it can cut lifespan. Yeah. So if we're talking here about optimization and people that want to have a nice lifespan and have this
and healthy lifespan,
this is one of the lowest hanging fruits to tackle. So how I typically start people off is just do it during the day, tape your mouth a couple hours, and then eventually transition to at night. And yes, I do not like the full coverage mouth tapes. Like there's a few tapes out there that they cover the entire mouth and you really can't put that on a child.
I'm claustrophobic, so it's the thought of that like irks me.
Yeah, I've used a couple different types and I still haven't really found one that I really love. I gave you my makeshift one today because there's nothing out there on the market that I actually think is useful.
And it has toxins in it, right? A lot of the tapes. Yeah. And you don't want something that close to your mouth. That's toxic. Well, we have enough toxic shit coming. Yes.
Like you're putting tape on them. Like some of these things are K-tape. Like it's strong tape. So not like a total fan of a lot of the mouth tape out there. But
how do you start your morning? Knowing all this information, knowing how important breath is, how do you start your morning?
I used to do more of what I don't do as much PRI as I probably should. I travel so much that I'm not always in one place, but I do live on the beach. So because I live on the beach, it's amazing. I typically will go, outside and I will just go on a walk and I'm right on the boardwalk and that's amazing. Beautiful. I don't drink coffee. Like I don't do a lot of the things regular people do. I am going to start implementing, I think like a nice juice in the morning. I want to learn how to make a really nice juice. I typically go and walk on the boardwalk. That's like the first thing. Get the sun in my eyes. In the summer, I'll go and walk on the beach or I'll go on a bike ride. Like I have the mornings free to myself every day. I don't like to have a rush morning.
It's almost being in nature is what you're saying because your body regulates itself really, really well. And if people are listening, they're like, hey, if we're hearing that breath is so important and maybe they're like, hey, I want to maybe get into breath work.
Right.
Where do they start? How long? Some direction? Like where should they start? What should they be doing?
I like breath work from a meditative perspective. I'm biased because I love what I do. I love postural restoration. You see how you did one exercise today and it was like...
I'm still on it.
Yeah. Right. So I think those breathwork classes that are like an hour long or holotropic breathing, they can be useful. But I personally think to get into learning postural restoration is the best way because the techniques are very specific and they're very specific for a reason. And so like I'm going to tell you to do, I'm just going to have you work on that 1 to 2 times a day for 4 to 5 breaths. And it shouldn't take people, like you shouldn't really be doing more than 20 minutes of attentive breathing. I understand doing a class, and I've done them before, and I think they can be great, but I don't think that every single day an hour of breath work, I think it's too much sometimes. We like to take things to an extreme in our society.
That's just how we're like wired these days. What about breath work, like the box, like breath work box breathing, which is a 4-7-8?
Yeah, I like that. I think an exhale needs to be longer.
Okay.
So I think less of an inhale, more of an exhale. So if you can do, 4-second inhale, 10 to 15-second exhale, pause, and then do it again, I think that would actually be making that better.
And it's crazy when you do it correctly, how quickly your nervous system can regulate.
Yeah, it's fast. I mean, it's really fast. So after I work a day in Manhattan, I do 2 techniques and then I go home because I just worked. I saw patients. I need to
Regulate
get myself
yourself,
more regulated.
Yeah. And in all the time that you've been doing this work, what are some of the biggest changes you've seen impact on your health, on your emotions, and your physical body?
So my story with it is different and interesting because a lot of my stuff was more internal, like hormone related, and PRI can be very helpful for that. And I used PRI alongside doing a lot of other functional medicine things. And for myself with PRI specifically, my facial asymmetry changed pretty drastically. I gained like 3 or 4 millimeters of my mouth opening, which is really
Amazing.
a lot. And I didn't do it with any braces or anything like that. I just did that with like appliance and things that we use. I also had a head injury when I was 12. I got glasses when I was 15. When I was like in my 20s and I was training, I was an Olympic weightlifter. My prescription went up and I had insomnia for 4 years. So this is,
wow.
Yeah. So I had really chronic insomnia. I mean, like 3 hours a night, 4 hours a night, bad. And I was like 24, 25.
Yeah. And women need at least 8 to 10 hours of sleep.
Right. And it is the worst thing. Like my heart goes out to people who have insomnia because I know what it's like.
It's
and
painful.
It's very hard. And I moved to Texas to learn PRI. And within the first couple weeks I was there, I just did an optometry exam with my mentor's optometrist, and I was overcorrected by a full diopter in both my eyes. And so that's like going from, you're at 3, right? Something like if you're at 3, going to 2. So that's a big difference.
Yeah.
So we lowered that, and within the week, my sleep changed. Now, I didn't go from immediate having insomnia to not, but it changed pretty drastically. And within the year, I started sleeping. And now, knock on wood, it's been a couple years now, I generally sleep very well, like 8 hours a night.
It's crazy to me that when we can't, we take our basic core line functions like being able to eat, enjoy food, digesting, sleeping for granted. And the minute we aren't able to do one of those things, we're like, oh my God.
Yeah. I mean, you have a real point there because like, you're right. Now that my son, at the same time, I couldn't really digest well at all. I was just really struggling. And now that I can, I don't think about it as much. It's like, okay, I'm just going to enjoy this. I'm going to eat this. I'm just going to go to sleep early tonight. I had a whole sleep routine. I was so specific because if I did anything at night, it would wake me up.
You get anxiety thinking about the fact that you won't be able to sleep.
Right. And, like if I go out I was in a retreat in Tulum, like I didn't really sleep that week, because it was so much excitement. Yeah. But in my normal day-to-day life, I don't even think about it. So you're right. You do take advantage of those things.
Yeah. You don't appreciate them. And it's like going back to like the basics.
Yeah.
And getting in tune with our body and appreciating the small things and making the little changes that lead to becoming the big changes later.
Yeah. No, it's really true. So yeah, my story with PRI, I work with providers in Manhattan. I work with amazing providers. It's like my home base is Manhattan. And the changes we see are incredible.
Insane.
And not many people are doing this.
And how many sessions on average do people have with you?
I'd say if they do not have a vision and dental implication, it's anywhere from 3 to 6.
Okay.
And then if they do have vision and dental, maybe over like a course of, maybe like 8.
Okay.
9, 10. There are a handful of people that are much more complicated, LASIK, things like monovision. There's a lot of different things that can make it more complicated. And those people can be more complicated. That is very much so an outlier of the situation. Most people need 3 or 4 sessions.
And from that standpoint, like I know you have a lot of reoccurring clients. They just come back, and I mean, I can see why they come back. Like, I had like one session today. I'm like, wow, I just really could see, you know, a commitment in this. How far spaced out is the time between the sessions?
Yeah, so I typically do like 3 weeks right now because I'm just so packed, to be honest, that I can't get people in. But it's funny because once people are done, they're like, can I come get coffee with you? They're so funny. But yeah, I don't see people that often, but the people that I have, like when I do a first session with somebody, they come back.
Right.
And they're supposed to. I would like them to do a follow-up.
Right.
So it's about, the goal would be to get people in every 2 weeks. That's the way that I think many people do it. But 3 to 4 weeks, I still see a lot of progress with people. So I might work with somebody 5 sessions within 6 months, and then they're off on their way and they can continue. And that the pain they had for whatever amount of years, that's gone. Now, if somebody's been in pain for 25 years, it might take a little bit, but.
It's amazing. I just learned something new today, and it was just phenomenal because I'm always in the quest of like growing, expanding, and learning. And it's so nice to come across a new modality, a new practice, and seeing the benefits of it.
Yeah.
So I have a closing tradition I started on this podcast, and it's because everybody I speak to is so knowledgeable, and I'm always so grateful to learn from all my guests and, you know, absorb all this information. So I thought this closing tradition was somewhere to like wrap it up in a nice way and put a bow on it. So the question is, what is the one lesson or learning to date that has been the most impactful and has carried you throughout your journey?
That's a great question. I think the one lesson that I've really learned this year that I've been taking with me and I've really been thinking about is to really get to know who I am. And I think the more I'm learning who I really am, I'm able to help people, but also really be there for myself. And I think that I've given myself to people for so long, and that's part of my nature. I'm very compassionate. I love my job, but I also need to tend to myself and give myself that what I deserve, and that is learning who I am. So the last 10 years I kind of just was on this journey and didn't really know. And I think the last few years I'm really starting to see who I am and appreciate and value my knowledge and value my thought process and my consciousness level, and just seeing the world the way I see it. And I'm proud of myself for seeing that. So really knowing who I am and being happy with who I am.
That's a really beautiful insight. I always say when your glass is full, when your cup is full, then you can really be able to be in service to people and give.
Yeah.
Because you're giving from a place of not scarcity, but because you're expansive. And in your expansion, the way you share that energy is so different.
Yeah. Thank you.
Thank you so much for doing this with me. And I'm proud of you.
Thank you.
I love your gift of being able to share and what you're bringing to the world. And the fact that you just completely opened up my eyes to something different today. Thank you for that.
You're so welcome. Thank you for having me.
I love doing this with you.
Thank you for having me.
Thank you.